Go ahead.
Hi, this is Robin Lee, Bio 272, Dr. Fritz, and this is Frankie Stein, who's going to help me do my demonstration today. All right, we're going to review over our major blood vessels of the body. We're going to start with the aorta, which comes up off of the heart and actually arches behind. Right at the top there where it starts to branch off is our brachiocephalic trunk. We have the right subclavian, which comes off here. And then we also have our common carotids, which branch off and come up through the neck here, right and left. You can only see the left one at this time. When we come off of the right subclavian, we're going down through the axillary and the armpit area. Then it comes down into the brachial here on the inside of the humerus. The radius comes off on the thumb side, and then your ulnar artery comes off on the pinky side. The palmar arches, which you can see here in the hand. And then we have the digital arteries. Okay, from our chest coming off of the aorta, you can see where the aorta comes down here through the center of the body. And then we're going to branch off into the common iliac here as we branch off from the main artery of the aorta. We're going to come into the internal iliac, which will turn here just so you can see a little better, the internal. Then we have the external iliac. The femoral comes down the inside of the leg. We have the deep femoral here as well as the regular femoral a little bit further down. The popliteal is the one that wraps around the back side of the knee. You can see the anterior, okay, which is right here in between the bones. And then we'll turn Frank around here so that you'll be able to better see the posterior. This is your popliteal coming down into your posterior tibial, which is on the inside back of the knee. Then we're going to go back down, zooming in. We're going to come to the arches here in the foot, which is we've got your dorsalis pedis here, or dorsal pedal, top of the foot. Just think of dorsal fins on a dolphin, which would be the top side. Plantar arches here, and then your digital arteries that come down into your fingers or digits as they did up in the hand. Coming off of the aorta up through the brachiocephalic, we have the internal jugular closest to the vertebral column, and then we have the external jugular on the outside. Okay, we're going to go on with our review. We're going to go into the veins now. We've got the superior, which is the top part of the vena cava, which is blocked here by the sternum. And then we have the inferior vena cava. So coming off of the superior vena cava, we have the brachiocephalic vein. And then we go on into the subclavian, a little bit further out here. And then we go to the brachial, which is on the inside. And the brachial comes all the way down. You're going to see the basilic here. And then we have the median cubital. The median cubital is typically used for your blood draws. This is where the veins pretty much come together, and we can use that for laboratory blood draws. Okay, the cephalic vein is on the outside of the humerus, and that is a little bit further out into the tissues. Your radial is on your thumb side here, okay, coming down. You've got your ulnar, which is right here between, okay, and then we have the, okay, so coming down from the ulnar and the radial, we can see that we have our palmar arches here, 1 and 2, the digital veins that come down into the fingers as they will into the toes. The dorsal network is basically right in this area also. We're going to go back up here, and we're going to come into the inferior vena cava. And then we're going to come on down. Right underneath that aorta is basically the common iliac, right where the bifurcation would take place. We have the internal iliac here where you can see the small branches. The external iliac is the much larger piece here. The femoral vein comes down here, all the way down the inside of the leg. The popliteal vein is behind the knee. You can see this network back here. We have the posterior tibial, which is behind the knee, coming down. Then we go back to the front, to the anterior, which is between the bones right here. We have the small saphenous vein, which is on the very inside of the calf, and it's not actually attached to the bone. It's more out in the muscle tissue. And then we have the greater saphenous, which you can see hangs off here up into the larger muscle of the thigh. Coming back down, we have our dorsal arches in the feet, as we did with the arteries, and then coming down into the digital arteries of the toe. Coming back down, we have our dorsal arches here in the foot, the dorsal veins, and then we come down into the digital veins, which go into the toes like they did into the hand. So these are your digital veins. And then your dorsal network is right in this area as it was in the hand. Okay, we're going to continue with our veins. The inferior vena cava branches off right and underneath the aorta here would be where the bifurcation is. That is the common iliac. There are actually two branches of that. Then you're going to have your inferior, okay, iliac, and your external iliac. And then we're going to come on down into the femoral, which is going to come here. This would be your femoral vein. Your popliteal actually branches around the back side. The popliteal is behind the knee, coming here. Then we have the anterior and posterior. Okay, the anterior vein, tibial vein, is going to be right here. The posterior is actually branching back along that back side, which we can show you again here. This is actually the anterior, or excuse me, the posterior vein. We have the greater saphenous, which comes all the way down the very inside from the, this is the greater saphenous, which you can see comes clear down the inside to the ankle, all the way from up top, buried in the deep tissues. And then we have the small saphenous vein here on this outside. We have our dorsal venous arches here in the top of the foot. And then we have the digital veins, which come down into the toes.